Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, the producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Christina Kokorellis and Vanessa McMains about POTS, a syndrome marked by high blood pressure and dizziness that can be disabling. The syndrome has long been linked to viruses of all kinds, so it's no surprise that it's been seen as a long-haul symptom in COVID-19 patients, but it is concerning. We'll hear from a doctor and a patient today. Let's listen. Dr. Christina Kokorellis and Vanessa McMains, thank you so much for joining me.
Pleasure to be here.
Thank you for having me.
Today, I'd like to talk to you about POTS and COVID. So the first thing we need to do is define POTS.
So POTS is an acronym which stands for Postural Orthostatic Tachycardia Syndrome. And these are, medical terms which essentially mean it's a condition where there's symptoms that are provoked in an upright vertical position that improve when the patient returns to a horizontal or supine position. I would say the most common symptoms we attribute to POTS include fatigue, dizziness, lightheadedness, nausea, headaches, and brain fog.
It sounds like it can be really debilitating.
It certainly can. POTS is a spectrum, so I have seen mild cases, but I've seen the other side of the spectrum where patients are really non-functional and have a lot of trouble tolerating any amount of physical activity.
And we're hearing more about POTS these days because of an association we're seeing with COVID. Is there a link?
Even prior to COVID, we knew that many cases of POTS were presenting post-viral. So the thought was that the virus was triggering POTS. I would say in about half of the cases that I saw, we knew that there was that link. And
let me interrupt you here. You saw differences. You're talking about viruses before. You mean viruses aside from COVID?
Aside from COVID, right. So I would say the most common presentation to my clinic would be, a patient was feeling well, and then they had some type of virus. It could be strep, mono, a GI bug, whatever. And then they really weren't able to ever recover and continue to have these persistent symptoms. So there was always that association between a virus kind of triggering POTS. And now, yes, we're seeing that with COVID. And it's not really surprising since COVID is just another virus. But because it's, so prevalent right now, we're seeing a lot of cases of really those COVID long haulers who are developing POTS.
So, Vanessa, if you don't mind me asking, I understand you had COVID. How did you get it?
How did I get it? I was being very safe, but a friend of my husband went to hang out with some friends because he they have that mentality of all your friends who you're in your inner circle are being safe. So that means everybody's safe and we're sort of protected. Even though I sort of begged him, please don't go. We're having a bad spike. But he did anyway. And there were 5 of them that hung out and one of them carried the virus and all 5 of them got it. And then all 5 of them came and brought it to their families. And that's wives and kids.
Yikes.
Luckily, we somehow, none of us went in public after our exposure and everybody got it really fast. So it stopped with us and there wasn't any spread from this group. Thankfully, small victories. So
when did you realize that you had these symptoms?
COVID or POTS?
POTS. I understand that you have been diagnosed with possible POTS.
So basically, I got sick with COVID December 19th, and then I was sick with COVID for about 10 days, like active infection, like fever, body aches, all that miserable stuff. And it was about 5 days in where we were going to get a second test because I knew I needed a positive test because my first one was 2 days before symptoms and came out negative. Because we knew my husband was positive. I wanted to make sure I had a positive test because of I wanted to make sure insurance would cover things because this is America and insurance is wonky. And we were driving to the testing place, and I noticed I was really lightheaded. And I was sitting in the car, and I was like, "Man, I feel really good all of a sudden." Like lightheaded good, like almost like you had a glass of wine. And I was like, something probably isn't right if I'm feeling this good. And my husband's like, let's check your blood oxygen as soon as we get home, because that was one of the markers, like check your blood oxygen, make sure it's not too low. If it's too low, you got to go to the hospital. And that's when we realized like my heart rate was like 175. And I was like, holy smokes, like the little things like beeping. And so my heart rate started spiking when I was in mid-COVID. And so I had to be careful. If I stood up for more than, 30 seconds, like I clearly the heart rate would spike. I would get dizzy. I would have to sit down. Moving anywhere, I was like out of breath. But basically, when the COVID infection left, it was like the symptoms of the high heart rate and the dizziness upon standing just never went away.
So, Vanessa, you're still not feeling a whole lot better.
Yeah, I would try to do things like make myself dinner. And, I'd chop up onions and peppers, and then I'd get them into the frying pan. And then I would realize that my heart rate was skyrocketing. And then I'd have to like call my husband up to finish what I had started and then have to go lay down. So it's quite debilitating. Like I can get up and get a drink of water, or I can get up to go to the bathroom. But then I couldn't actually do anything functional, like leave the house or, or, like do laundry, right?
That's right. So, Christina, do people get better from POTS? Will someone like Vanessa, are the COVID patients like Vanessa getting better?
My expectation is yes. We typically expect slow and gradual improvement in POTS symptoms with time when these patients are properly managed. A lot of time for POTS patients, the hardest part is actually getting the diagnosis, so it's not commonly recognized. But once it's recognized, we actually have really good treatment options for POTS. And I would say most people do make a really nice recovery.
What kind of treatments?
So treatments kind of start with lifestyle changes, including really aggressive hydration and salt intake. In addition, we usually recommend wearing some type of compression, so like compression socks or leggings. And really the mainstay treatment is exercise. What makes it difficult is that a lot of patients have so many symptoms that they can't really tolerate a lot of exercise. Mm-hmm. And then in addition, we sometimes use medications or saline infusions.
So anecdotally, I've heard that some long-haul patients' symptoms ease after getting the vaccine. Are you seeing that in the POTS patients?
I have seen the vaccine make like POTS symptoms worse and POTS symptoms better. So I have not seen anything consistent. Our clinic does recommend, whether or not you have POTS, we do recommend getting the vaccine to prevent COVID.
Mm-hmm. Vanessa is nodding her head.
Yeah, as I had COVID, I've anecdotally heard that people who didn't have COVID get their first vaccine and they have barely any symptoms, their second vaccine, then they may have like fever or whatever. Having COVID, the first vaccine was the worst. I was violently ill again. And then my tolerance once again dropped, like tolerance to standing. And I just had my second vaccine last Friday, and my tolerance is still recovering to what it was pre-second vaccine.
So, Christina, I think COVID's going to really have provided us an opportunity to learn a lot more about POTS and the long-term effects.
I think so. Like I said, we're treating it the same way as we would treat other cases of POTS, and we're using the same treatments. And I think time will kind of tell, the outcomes. It's still kind of a new phenomenon. But the hope is that, this will bring awareness to POTS in general, because it is a prevalent condition that is under-recognized and under-diagnosed.
Mm-hmm. And I guess with so many COVID patients, there's a lot more opportunity to study.
Correct.
Vanessa, what do you hope for the future?
Well, I just heard that NIH is designating $1 billion to study post-COVID syndromes. And of course, that isn't just POTS. That's all kinds of spectrums of symptoms that people are having. So that's promising because it's going to affect a lot of people. And I think it's going to be a burden on our healthcare system for years to come. I am extremely hopeful. My treatment is working. If I can talk about my treatment, my doctor, I'm going to a Johns Hopkins cardiologist who is amazing. Her name is Erin Mikos. She's been treating post-COVID patients for a couple months now. Obviously, you got to keep yourself hydrated. You want your blood volume to be as high as possible. So I drink lots of water and lots of electrolytes all day. She put me on a beta blocker to keep my heart rate down a little bit. And I'm on compression stockings, which forces the blood up out of your legs so it doesn't pool. And she wanted me to do walking therapy. And so every day I try to walk a little bit further. Some days are better than others. When I was before I started therapy, I could only do about 500 steps a day. Now I'm up to about 5,000. That's not all at once. That is, taking lots of breaks, but I am no longer housebound and I am making more improvements every week, I would say. So I am hopeful that one day I will get completely better. And I think that a lot of people with the proper advice and healthcare can get better too. But I have heard that a lot of people are extremely debilitated. And I'm not sure how common POTS clinics are around the country. I know they're opening lots of post-COVID clinics. And so I hope many people can get in there and get the same kind of care that I'm getting so that they can get better too.
Vanessa McMains and Christina Kokorellis, thank you so much for joining me.
Thank you.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.